Hospice nurse Carlos Irizarry here out of Tampa, Florida. I got a DM on my YouTube channel that wants me to break down exactly what is hospice. Bear with me, guys. I have some notes here. It's been a long week. Let's go ahead and jump right into it. Hospice is a specialized type of healthcare, focuses on comfort, quality of life, and symptom management for people who have serious illnesses and are no longer seeking curative treatment. The goal for hospice is not to cure the disease, but to help patients live as comfortably and as meaningfully as possible while supporting their families and caregivers. Who qualifies for hospice? Well, I'm speaking here for the United States. I do have viewers all over the world, but this is just for the United States. The patients who qualify have a life-limiting illness, have a physician certification that life expectancy is approximately 6 months or less if the disease follows its course, or a patient chooses comfort-focused care rather than aggressive curative treatment. For instance, we have a patient who has cancer. They've been doing chemo for about 18 months. They no longer want to do chemo. They just want to focus on comfort care. That's a patient who will be admitted into hospice. What type of services does hospice provide? We provide physicians, nurses, home care aides, social workers, chaplains, spiritual counselors, and bereavement counselors. We also provide volunteers. Services often include pain and symptom management, medication management, medical equipment such as hospital beds, oxygen, wheelchairs, emotional and spiritual support, assistance with personal care, education for caregivers, and especially grief support for families after a patient's death. Where can hospice care be provided? We can either do it in a hospice unit, we can do it in a private home setting, we can do it at an ALF, assisted living facility, or we can do it at a nursing home. Hospice teams help manage symptoms such as pain, shortness of breath, anxiety, nausea, fatigue, restlessness, difficulty swallowing, and constipation. Me as a hospice nurse, I go out, I have a caseload, I see my patients every day. I make sure they have their medication refills. I make sure they have their supplies, such as gloves, wipes, bed pads, anything they need for their care. I make sure they have hospital equipment if they need it or request it. And I make sure I collaborate with my team every week to go over our patients. A big misconception about hospice is many believe hospice means giving up. In reality, hospice shifts the focus from curing the illness to maximizing comfort, dignity, and quality of life. Patients often receive better symptom control, and families receive extensive support during a difficult time. I want to thank you guys for watching this video. If you haven't, please subscribe. I'll be releasing content on a weekly basis. We'll be going over everything regarding hospice, and thank you for checking out the Hospice Care channel on YouTube and TikTok. Thank you, everybody. Have a good night. God bless.